Compartment syndrome is a medical condition where there's a build-up of pressure within the muscle tissue. It can constitute a medical emergency because the longer it goes undiagnosed, the potential there is for skin necrosis, death to the tissue surrounding the muscle, potentially also nerve damage. There are varying causes of compartment syndrome. Sometimes compartment syndrome can be caused by an injury. Alternatively, as medical negligence lawyers, we often see compartment syndrome arise after a long surgical procedure. Where a patient believes they may have suffered compartment syndrome as a result of negligence, we would always recommend speaking to a solicitor for advice. The solicitor will discuss with the patient whether there has been a long surgical procedure, for example, whether potentially appropriate steps weren't taken during the surgery to prevent against the possibility of compartment syndrome arising. Alternatively, there may be a situation where there's been a delay in diagnosis of compartment syndrome, for example, post-surgery. These are all issues that a patient can potentially talk through with a qualified medical negligence solicitor to see if they potentially have a claim. So Jane came to see us after she suffered compartment syndrome following a long gynaecological surgery. Unfortunately for Jane, her compartment syndrome had led to a condition called drop foot, which is a condition where a patient is no longer able to use their foot in the normal way. It affects walking and mobility generally. Jane herself was employed within the NHS, and the drop foot was affecting her ability to travel to work. It was affecting her ability to care for her young daughter. So she was seeking legal advice on whether she could bring a claim for the injury that she had suffered. We, with the benefit of independent medical expert opinion, looked into the performance of the surgery that she had and whether appropriate steps were taken to minimise against the risks of compartment syndrome arising. We also looked at Jane's post-surgical care and whether there'd been any delay in diagnosis of the compartment syndrome. Compartment syndrome being a medical emergency requires the patient to be transferred back to theatre and for there to be another surgical procedure to relieve the pressure within the muscle to try and avoid death of tissue and potential nerve damage. So with Jane's case, we were looking at whether the diagnosis of her compartment syndrome was made in a timely fashion and whether she was returned to theatre quickly enough. We were able to secure supportive expert evidence, and we were then able to look at quantifying Jane's claim, which required us to look at what injuries had been caused by the negligence that she had suffered. Because her injuries were quite severe, they impacted on things like her earnings, so she did suffer some loss of earnings. It impacted on her ability to care for her daughter. It impacted on her ability just to move around her house and to enjoy leisure pursuits that she had previously enjoyed prior to having that surgery.